My name is Tanisha McCauley, and I serve as the Executive Director here at the Cobb Family Advocacy Center.
I'm Megan Shea, and I am one of the victim support navigators here at the Family Advocacy Center.
I'm Zoe, and I'm also one of the victim support navigators here at the Family Advocacy Center. Well, I've always wanted to help others, and whenever I went to college, I went to Kennesaw State University. I studied psychology, sociology, and criminal justice, and I really liked the way that those subjects overlapped. And again, I wanted to help people, so I wanted to be in a service industry, and largely that is victim assistance. So I was previously at the district attorney's office here in Cobb as a victim advocate over there. And what led me to come over here was seeing that that was just a piece of the puzzle and that there were more pieces to be had, if you will. And so I wanted to be a part of that expansion.
For me, I have also always wanted to help people. At first, when I went to college over in Alabama, so I started out as elementary education major, but later I found out that I wanted to do more for children and just people in general. And so I got into social work, and I had my master's in social work. And this is just a position that I really enjoy, that I can help so many different people. And in the service areas that we have, I'm really big in helping those victims that need help and the support.
Well, as the executive director here, I've been in the industry, let me just say that, for over 20 years. And my background has been in behavioral and mental health. And when I first got started in my career, I started out as a licensed clinician. I was providing those direct care services to adolescents and youth, what we term youthful offenders, those that were really struggling with a lot of behavioral and mental health matters. And so throughout my career, I've worked in program management, program development, and I've had the opportunity to work specifically in the area of domestic and family violence. And it has truly been a great journey. I've learned so much. There's so much to learn. And what I've identified is that there are so many intersections when we look at domestic violence, mental health, behavioral health, substance use, and all of those connections. And the same as our navigator shared, I have a passion for helping people. I want to see people improve the quality of their lives. And in any capacity that I'm able to give and do that, I enjoyed. And so being with the Family Advocacy Center is a direct way that we are able to help families in need. We are really excited about this initiative. One, because it brings partners together under one roof. What we've seen when we have participated in focus groups with victims, whenever a victim is navigating a domestic violence matter, there are so many different places that they may have to go to get the help that they need. And we also understand that contributes to the trauma that they're already experiencing or going through. So when we have a model such as the Family Justice Center, where we are working collaboratively with our partners and we're all speaking the same language, we're all saying the same thing, victims can come to this location and hopefully be able to get the services that they need in that one time and not have to go to so many different places. That's making a difference. The research has shown with family justice centers, when they have been implemented in communities and they have the buy-in from their communities and their partners, it can reduce domestic violence homicides by up to 90%. And that is phenomenal, because what that is saying is that family justice centers, the model and the collaboration, it does save lives.
The services we're providing here are mainly reactionary. It takes a lot of preventative measures as well to actually eradicate this issue we have, and a lot of destigmatizing on domestic violence as well as mental health in general are key to that.
I think based off of what we've seen so often, it's a lack of awareness. You'd be surprised at communities and folks that are, community activists, constituents, all of those folks around that really, they don't really know how prevalent domestic violence really is in their backyard, sometimes it can have a stigma. Domestic violence can have a stigma attached to it, and people will assume that, oh, if I'm not in a certain area, or if I'm in a certain income bracket, or a certain faith that I practice, that domestic violence doesn't exist or it doesn't impact me. But what we realize is that domestic violence and family violence, it impacts us all in some way, whether it's directly or indirectly.
Domestic violence can happen to anybody. Like Tanisha had mentioned, it doesn't matter your race, ethnicity, socioeconomic status, your education level, can happen to anybody. And it's also proven that children who have seen abuse in the home will more than likely become the abuser or be victims of abuse. And so it's really difficult for those children. And we want to break that cycle in our community and make sure that we spread that awareness. It can happen to anybody. It's a cycle. We have to stop it, and just trying to get the education out there so we can do the best we can to decrease the numbers.
Talking about what healthy relationships look like, because oftentimes we can see things that are perpetuated at that area that can ultimately turn into something more severe. What we've seen is that the term domestic violence can really be triggering in certain environments. And so we've, identified other language that we could use, because we do understand the cycle of violence. Once an individual is in a domestic violence matter, it's not that easy for them to just walk away. And so it's much more prudent to start to have discussions from a place of prevention, and how can people identify what is considered unhealthy and things that they should really be paying attention to. That's another part of when we talk about domestic violence. We talk about the verbal abuse. We talk about the emotional and the psychological abuse that sometimes people do not equate with being domestic violence. So prevention is key, and there is a prevention component that really can impact lives and ultimately save lives. When they come to the Family Advocacy Center, and that's just any family justice center model, there's an intake process so that we can ensure, again, that they do meet the criteria that falls under what you heard Megan mention earlier, those purpose areas. So at the FAC, we focus on domestic violence, sexual assault, human trafficking, stalking, elder and child abuse. And so when someone comes to the center, if they identify a need in one of those purpose areas, we are able to serve them. And it's a very secure site. We are not a center that works with the abuser or the offender. Those are services that they will have to seek outside of the organization. But safety is key. And so we understand the importance of having the proper security measures in place to keep everyone safe, the victims and the individuals inside that are providing those services.